Obesity prevalent among Native American children. Why is this topic important? For children of our country, obesity has become a sign of major health risk. Type 2 diabetes, as well as other chronic conditions like hypertension, coronary heart disease, and several types of cancer, are all made more likely by childhood obesity. For kids and teenagers, obesity also raises the risk of social and emotional morbidity. Moreover, obesity in children often carries over into adulthood. In comparison to children in the United States, American Indian children have a higher prevalence of obesity and accompanying health issues, such as type 2 diabetes. Nevertheless, earlier predictions of childhood obesity among American Indian and Alaska Native children were based on small regional studies with few participants. National studies on the prevalence and severity of obesity in children and adolescents within AI and AN culture have not been conducted. It is important not only to broaden the study to national limits, but also understand why prevalence of obesity in AI and AN communities is so much higher when compared to the regular population. Objectives. The primary factors within this study are to understand why the rates of obesity in American Indian and Alaska Native communities are so high when compared to that of the general population. Understand the long-term conditions and health consequences of childhood obesity, and to estimate obesity and overweight prevalence in American Indian and Alaska Native children across genders, ages, and geographic regions in the Indian Health Service and active clinical population. The population that will be discussed for the study is American Indian and Alaska Native youth within the United States. Native civilizations have valued interdependence from the dawn of humanity. The tribal elders of tomorrow will be the children of today's tribal leaders. Native adolescents have a distinctive point of view on the world and possess a specific ability and will improve their communities. Youth are unquestionably tribal nations' future. Many of them are already making a difference in their communities as leaders and change makers. Findings. In American Indian and Alaska Native children, ages 2 to 19 in 2015, the prevalence of overweight and obesity was 18.5% and 29.7% respectively. 31.5% versus 27.9%. Males were more likely than girls to be obese. Obesity were more common among youngsters between the ages of 12 and 19 than among younger children. In the National Health and Nutrition Examination Survey, the American Indian and Alaska Native children in our study had a greater prevalence of obesity than the kids in the U.S. as a whole. The outcomes were from the 2006 to 2014 comparable study. Type of study. The study I chose to discuss is a cohort study. Cohort studies are a sort of longitudinal study that involves keeping track of research subjects throughout time, often many years. Cohort studies specifically enlist and monitor participants who have something in common, like a study of a specific occupation or demographic resemblance. Certain members of the cohort will experience a certain risk factor or characteristic over the follow-up period. By tracking results across time, the effect of this variable may then be investigated. For example, identifying the link between smoking and lung cancer in British doctors. Hence, cohort studies are particularly valuable in epidemiology since they contribute to our understanding of the factors that neither increase or decrease the probability of getting a disease. Study sample. The study made use of information gathered every fiscal year from October 1st to September 30th from the years 2006 to 2015. At medical facilities receiving federal funding that provide care to American Indian and Alaska Native patients in all 12 Indian Health Service administrated areas. The facilities include IHS hospitals and clinics run by the federal government, as well as ones directly run by tribal governments under agreements or contracts with IHS. Urban Indian health organizations that offer services to AI/AN individuals living in 34 metropolitan areas were also listed. About 2.2 million AI/AN people who are members of 567 federally recognized tribes in 36 states are served by these healthcare facilities collectively. Statistical analysis. SAS-based and SASStat software, version 9.4 of the SAS system for Windows, were used to analyze the data for this study. There was significant overlap in the children included across the fiscal years, making it difficult to distinguish between children from one year to the next. Thus, we did not undertake statistical comparisons in the study. Instead, we produced descriptive statistics and confidence ranges. Using SAS survey and analytical tools, we adjusted analysis for the spatial clustering of patients. Results. Every year, from 2006 to 2015, under study, BMI information was available for at least 184,000 American Indian and Alaskan Native kids ages 2 to 19 years old. Results from the 2015 alone show, together with trends from 2006 to 2015. This information is located in the chart to the right of the page. Conclusion. The prevalence of obesity among children within the AI/AN communities in the IHS Atypical Clinical Group is still high and is greater than that of children in the United States as a whole in the NHANES survey. Our results do indicate that there may have been a recent stabilization in the prevalence of obesity among among American Indian and Alaskan Native children in this community. Public health policy interventions aiming at childhood obesity should be inclusive of and culturally sensitive to AI/AN groups. In order to overcome the ongoing gap of higher obesity prevalence among AI/AN children. Agreement and bias. At the conclusion of the study, I do agree with the conclusions. I grew up in a Native American reservation as a child, and I've worked with Native American youth as a substance abuse counselor for the last 5 years. I believe the study highlights weight as a primary struggle of youth in these communities and shows that greater research must be conducted on this topic. The study primarily looked at Indian health service clinics, which are federally funded and often run by non-Native persons. This can create bias based on my personal knowledge that many Natives seek treatment at local clinics instead of IHS-ran facilities. Ultimately, at the conclusion of the study, I believe the study designed for the specific topic was the correct choice. A cohort study identifies a group of individuals and keeps track of them throughout time. The goal is to examine how a group of individuals is exposed to various risk variables that could have an impact on their life. Cohort studies can examine a variety of facets of people's lives, such as their health or social circumstances. Cohort studies may be prospective, data gathered as people lives progress, or retrospective, meaning that researchers look at historical data about individuals with a certain outcome, such as a diagnosis with a disease that has occurred. References. Bullock, A. Sheff, K. Moore, and Manson.